Welcome this morning. My name's Andrew Brown. I'm from Management Sciences for Health, and you have reached the session looking at professionalisation, getting practical with supply chain professionalisation. Thank you so much for joining this session. Before me, I have a lovely panel who needs no introduction in a number of ways because you've seen them in sessions already, but I would encourage you to have a look at the app in order to see who they are and read more about them. We're going to hear their perspectives on professionalisation shortly. But first of all, I want to remind you, if you can open the app, if you can go to this session, and you can choose the Q&A, you'll have that ready. And we would encourage you during this panel discussion to really ask questions through that way, and I'll be monitoring that. I was learning from Ian Barton that we shouldn't be ignoring the app. So let's go on this journey together. So what is professionalisation and why is it important? In private sector as well as in public sector, we've been hearing for the last couple of days the importance of workforce. We've been hearing the importance of careers. We've been hearing the importance of retaining workforce. Capacity strengthening workforce is not just training. Professionalisation involves creating careers. It involves ensuring that there is an ongoing environment for supply chain workers to engage. It's interesting that those skills and competencies are similar across sectors, public and private, although we often are in our own silos. We're really excited with SAPEX this year to have a healthcare track. And just for a moment, why is a health track important? 1/3 of the world's population don't have access to medicines. One of the reasons for that is the poor supply chains in a number of low and middle income countries. One of the aspects of poor supply chain is the lack of skilled human resources in sufficient capacity to meet those goals. You may have heard about the Sustainable Development Goals, universal health coverage. These are bandied about words at the end of which are women and children dying in many countries, particularly in sub-Saharan Africa, which has a greater burden. Workforce in supply chain management is under-focused, and particularly the professionalisation of that is not talked about in sufficient systematic terms to make a difference. I'm going to introduce you to 2 slides, and then we're going to hear some perspectives from our panel and engage in a discussion around aspects of professionalisation. And by the end of our time together, we hope that you'll be able to go away with some practical approaches that you can use both in your organisations, as well as think about how you can interact with the community around you to catalyse and improve this market. On the screen is a professionalisation framework that has been put together by a number of people globally under the umbrella of People That Deliver. People That Deliver is a global advocacy organisation focusing on workforce in supply chain. Now, I mentioned before that capacity strengthening of workforce is not training. I mentioned that thinking about workforce professionalisation in the context of a labour market is helpful. And here we're talking about the supply and the demand. We're talking about understanding the competencies that make up the various professions in supply chain management. We're talking about creating the education in a local context that is suitable for those professions. But we're also talking about engaging with government, organisations in the private sector to help them understand the workforce they need and to actually ask for the right workforce. And this particular framework that's on the screen helps to define that and think about ways to catalyse the broader marketplace for professionals in supply chain so that our industries can become stronger. This next slide is a village reach approach to operationalising what we just saw in the professionalisation framework. It helps us to think about the necessary coordination to make this work, but it's also an understanding that we need to think about both pre-service training and education and also workplace environment. And when you look at this particular model, it helps us to practically think about what are the education requirements, what are the job descriptions, how do job descriptions match with education requirements, How do we develop staff in order to move along and to grow them in careers and keep them in our organisations and business? The end goal is to have this pipeline of adequately locally trained supply chain professionals. And we know from our own work that those professionals move between sectors, but we ourselves might think about our sector separately. So let's go to the panel and let's think about and learn from them on this journey together. So Dominique, let's start with you. Please, what perspective do you bring with regard to professionalisation?
Okay, thank you, Andrew. So I'm here representing the People That Deliver Coalition, and we are the global technical leader in human resources for supply chain management in low middle income countries. And basically, through this coalition, we have a convening power. We are able to influence, catalyze, and convene a key group of stakeholders that are bringing global recognition to the issue of basically not well-trained, qualified health supply chain workers. The other thing is this systematic approach you were just talking about. Basically, we are addressing both the supply and demand for these professionals in this industry. We're looking at professionalization as our focus, considering both the demand and supply, like I said. Looking at sort of professionalization interventions, thinking about standards, but also thinking about youth engagement, women, diversity and equity, as well as higher education. What do we do with that? And then with this professionalization framework that you just showed, so that's really the first of its kind, and using that as a way to start to work with countries to implement this journey of professionalization. So you'll hear from Azuka, we are working currently in Nigeria, Rwanda, Mozambique to really focus on country-level impact. And I just came from Rwanda, where we were working with the East African community countries to also start with their professionalization journeys.
Great. So let's take that opportunity to go to Azuka. Let's just get a country flavour here. What perspective are you bringing to this discussion?
Thank you very much, Andrew. When we started working, I represent Africa Resource Center for Supply Chain Excellence in Supply Chain Management. It's a mouthful, so we just say AKSM. And we have been in Nigeria since 2016, and our primary focus is to support governments in their health transformation journey. And we partner mostly with funders like the Bill and Melinda Gates Foundation, Global Fund USAID. So we got this project with Bill and Melinda Gates Foundation that said we should work with national and state governments to address their supply chain needs. We are like a resource center. Government come to us to access the resources, and it could be people that deliver, it could be a training institution. And we were expecting to get major transformational projects from government, but they kept asking for training. We need training, give us training. Every government institution we went to, they were asking for the same thing, training. Partners were saying, don't train them. We've trained them several times, so there's no need to keep, and it was the same group of people asking for training. So we went to government to identify why is training such a challenge. And it came out, and that's the thing we're trying to, the perspective we're looking at. What they said is, Azuka, when I get trained, the expectation is for me to do a particular job. If I do that job, I'm not going to be paid for that job because I'm going to get paid regardless. There is no clear path of this training in my career path in the government institution. So if I get trained and I do the work, I don't get more training. So train me, I won't do the job, so you keep seeing it as a gap, and you keep training me so that I get the other perks in the training. I get to travel, I get to get my meal stipend or per diem, so I will get trained, I will not do the job.
Okay. So digging deeper, looking at some of the root causes, and one of those is this sort of lack of career and this lack of approach. And I'd like to come to Rebecca here because you've been looking at this from Village Reach for a while in a number of different countries. We saw your approach. Help us understand a bit more about this practical application in the country context.
So I work for Village Reach, which is an organization that works with governments to bring healthcare services closer to people. And so the perspective that we bring is that of working with governments over the long term at the national and subnational level. And our job with the government, essentially as our clients, is to help ensure that those workers and the government decision makers have the skills and the knowledge and the capabilities to support a well-functioning supply chain. So are they armed to make those informed decisions? Are they the people on the ground? Do they have the knowledge and skills to manage their inventory, to use the digital tools? And how we do that is illustrated on the slide that Andrew alluded to earlier. First, it illustrates how and why we work with governments and why it's so important to have them at the center of this conversation. It's because we know from our work experience that having government stewardship and leadership is not just important in setting priorities, but it's important in making sure that any initiative can continue and be sustainable. Mm-hmm. We also look across the career path, so looking at designing interventions for people before they enter the workforce. So the middle bar, looking at the education and the preparation that they get before they enter the jobs, and then supporting them once they are in a job and maybe need additional skills, looking at the professional development opportunities through organizations like IPHL. And I'll just reemphasize what has been said already, but that what we do is not just training. In fact, I would even argue that we, over the long term, would like to do less training. We'd like to create systems that have mechanisms, that have the educational pathways, that arm people before they enter the workforce so that you don't need to keep training them over again. So that's sort of there's the short-term training goals to fill, be Band-Aids for these problems, but then over the long term, we're looking at shifting systems that really cater to the workforce and their job needs.
Great. Thank you. So we've got this sort of global perspective. We've got a deeper dive in Nigeria, looking at some of the root causes, and clearly from your model, also looking both at supply and demand. Douglas, ASCM with SAPIX, you've been working in workforce development for some time. You work with thousands of private sector organisations. Do you want to help us understand what view you're bringing to this conversation?
Well, I think, as already been said, it's a complex equation, right? So the good news is supply chain is at the forefront of everyone's mind, whether it's public or private sector. We've been through such a level of unprecedented supply chain disruption that has seriously impacted not only companies' revenue and profitabilities, but the ability to receive critical medicines and vaccines in certain areas. It's affected country-level GDPs, et cetera, so it's certainly top of mind. ASCM, as you probably know, is the largest nonprofit for supply chain management in the world, but our job is to try to figure out what remains relevant in terms of educational need, and that's not a small task with the level of progression that we've seen within supply chain. So today's need may be, sometimes we're trying to figure out what tomorrow's need is before we've even figured out what today's need is as we try to bounce to the new forward. So I think two critical aspects in my mind. The first is we have to have education, training, certification across the entire career pathway. So as Azuka mentioned, certainly entry-level foundational understanding, end-to-end supply chain is certainly necessary, not only to operate the supply chain, but also to attract people to the profession. This is also equally as important. One of the things the organization also really focuses on is the relevancy of that training, and that's not also an easy task. So for our certification programs, for example, we have to do a jobs task analysis every 3 years to make sure that the content in which we're training is relevant to the people who need that professionalism. And that's a major effort that happens on our side, and we redo that content every 3 years in order to do that, and introduce programs which are, which again, you as those who need supply chain professionals really see as top of mind, whether that's learning new digital capabilities and the applications of those, whether that's how to operationalize sustainability into the supply chain on an ecological and ethical standpoint, et cetera. So we have to stay ahead of the market so that we can create the tool sets that satisfy the needs along the career pathway.
Great, thanks for that. And what I'd like to do is just take a step back for a moment. And with ASCM, you recently did some research. I was in one of your sessions late yesterday where you were looking at agility, sustainability, and so on. And you shared with me some research. What do you think is some of the most important challenges that you see across your members, particularly from the private sector with regard to workforce? Where's the pain?
Yeah, everywhere. Yeah, I mean, there's a lot of pain that's out there, but the reality of it is, and I think the research that Andrew's referring to is just taking a look at supply chain stability, and this was a collaboration effort that we did with KPMG, and just taking a look at what are critical things that are actually impacting the stability of our supply chains today. And when you do this type of research, which is a variety of complex variables that go into it with machine learning in the background, et cetera, it actually illuminates some critical needs that maybe are a little bit unanticipated. So if you take a look at the last few years where there has been an unprecedented amount of disruption, you have to also look at the variability of those disruption factors. And one of the things that came out of the research was that fulfillment capabilities were a major contributor to instability, and that isn't often the case. Normally when we think about instability, we think about the imbalance between demand and supply. We don't often think about how difficult it is to get goods from one place to another, and certainly distribution logistics was what became a big part of that. What that opens up is there are other factors or correlating factors in that research. For example, commodity pricing has been top of mind because critical metals and lumber and other critical components raised so drastically in their pricing, as did transportation costs, et cetera. So now what you're revealing is now companies have to internalize that and say, oh, now I have to build new skills and competencies into my organization. I need to have network optimization design capabilities, for example, or I need to have better commodity management and strategic relationship management with my supply base. These are things you have to watch guard to understand, again, forward-looking, what are the needs, and that research component assists us with that understanding so that we can further the education possibilities to satisfy those needs.
And I was also looking at some of the US labor market statistics, and it surprised me that supply chain organizations in the US have a 20% staff turnover, according to the US labor market.
Not a surprise to me.
Okay, so some problems. Okay, let's go to country perspective on this. So Azuka, in Nigeria, you spoke in general terms about some of the issues there, but can you speak more specifically about what you're finding as the challenges to do with workforce and supply chain?
I think the most important thing we discovered was that there was no clear standards that government had defined for what the impact of the training, or who does the training, or the certifications, the standards for job descriptions. It was more partner-driven to train the workforce. So one of the things that the government has been doing was having a clear national health supply chain strategy for 2021 to 2025. Within that, it's expected that the workforce will be able to deliver on that strategy, but there was no framework that would show that, again, the career path. If I get trained, what does that mean for my growth? So the major issue was that standard, that pathway, which was why I recall in HHL conference in Dubai, it was like an Eureka period. I was talking about training, and Dominic can be sneaky. She came to me and she said, and then what? Why all this training? What's the part? I'm like, what is she talking about? But when we were now at that stage, and she had planted something in me, when the government were talking about training capacity, I said, wait, we need to think about a clear framework. We need government to take ownership in defining the standard. We have the right certifying bodies, involve the universities, look at the whole ecosystem. So it's that framework, that making sure you have that clear pathway to, and not look at training, but look at, like you said, the whole human resource professionalization framework, so that the trainings and whatever in education would count into an individual's career path. So for me, that's really a plug in where we were.
And I promise I didn't pay Azuka to say that. For those who know me, this is like joy to my heart. So Dominic, let's come to you. You've got a public health perspective, but more globally. What are you seeing as the particular challenges with the countries you interact with?
Yeah, I mean, I just really want to stress the point that the most important supply chain workforce challenge really is this seeing supply chain management not as a profession, that it's not professionalized, that there is no global standards. And we know that by building a profession, you're giving it the highest integrity, the highest competence. And if we're looking at countries and you're not giving that to these professionals and saying that their technical capacity is not important, then they're the ones that are managing and operating these supply chains. And we saw yesterday that $50 billion is being spent annually on health products. $50 billion, but you will not invest in the workforce? That doesn't make any sense to me at all. And so this is why, one of the reasons why I've been really advocating for the need for this for so long, and for the development of this professionalization framework. We also, of course, see no really formal qualifications at country level, so working with these partners on that. And then the other thing, of course, is the civil service structure. Like even yesterday in the Benin youth engagement presentation, we saw that health logistician doesn't really exist. It is an administrative person in the civil service structure. Again, the health supply chain work is not getting the recognition, and I think that's a big issue.
And what's interesting in Benin, a couple of my colleagues are there, and they've been trying to work on changing this for the last at least 10 years.
Oh, yeah.
So one of the other takeaways is when we're working with governments and environments to change the labour market environment, these are structural changes that take a long period of time. So thanks for that. So let's come back now to Rebecca again. Again, you're involved deeply in a couple of countries. You guys focus particularly on the last mile, a passion for that. What are some of the workforce challenges you're seeing that are limiting supply chain?
Yeah, I mean, I think echoing what some of my colleagues are seeing, I think it's that lack of career path, but particularly starting in the early career path, engaging youth and getting people on this track to begin with. I have never heard a teenager say, I want to be a health logistician when I grow up. That visibility as a profession is not there yet. Supply chain happens a lot in the background, and I think there's lots more we can do to be sensitizing youth to this as a profession. But I think also in parallel, we need to be strengthening those education pathways so that there is something set up in front of them that they can see. Like Azuka was alluding to earlier, that career path has not been charted out by most governments to say, if you get this degree, then you will become a junior logistician and a senior logistician, and you can grow in that career. And it's not something that people can see yet. So very important to be strengthening those pathways, making sure the degree programs are there. I was speaking to a colleague in Nigeria the other day, actually, who said until recently, a country of, I think it was 215 million, there was no university that was offering a bachelor's degree in health logistics. It's a huge country with huge logistical challenges, and so that was really shocking to me. And we found the same situation to be true in Mozambique. That's the country that Village Reach works in. And so we're working with a local university to remedy that and create the first bachelor's degree in health logistics. So it's an area that I think of as huge opportunities, and an area that we can be collaborating across sectors to remedy.
Great. So I think the challenges are clear, and I would encourage you to find that app and send those questions. Questions are coming through. I'm noting those, but they're going to come. I'm going to hit the panel with these shortly. But before we hit the panel with that, I want to give the opportunity for our panelists to sort of spruik their Australian word. Are you familiar with the word spruik? Someone gets on a box and in the middle of the room and says what the best solution is for something? Blame the Australian. Sorry about that. Okay, so let's, Rebecca, stay with you. Okay. So we're trying to look at innovation and approaches to sort of fix these problems. We know these problems are complex, they're multifaceted, we know that multiple stakeholders, they take years to fix. What's the big exciting thing that Village Reach is working on?
So the program that I'm most excited about, you may have seen on your way in, there are these very beautiful flyers, for a project called the Girls on the Move program. And this is an internship project that is designed to help young women entering into supply chain. And I am excited about it, particularly at this conference, because yesterday I attended a panel on emphasizing the need for more youth in supply chain. Today there's a panel on integrating more women into supply chain, and I think this project does a really great job of encompassing those needs with the ultimate goal of strengthening supply chains. So what it does is links women that have recently graduated with employment opportunities both in public and private sector. So you get benefits through the Ministry of Health as well as the private sector companies. They get interns who are getting leadership coaching, who are getting extra supply chain skills building. So the employers win, and then the interns win because they're getting this career guidance, and they're being put on a career path. This is what we were just saying is really needed. The founder of this project is Pam Steele, and she had a great way of describing it to me when I was learning about the project. She said, ready to go supply chain workers are not just sitting on the supermarket shelves like a loaf of bread ready to go. You have to shape them, you have to nurture them, and then to put them on that right career path. So I think that's what this project does, and Village Reach is really excited to work with Pam Steele to scale this project and bring it into other countries as well. We're hearing lots of expressions for need all around. So it's exciting. I think it's scalable, and we're excited to do that.
Fantastic. And of those sort of interns in the first sort of couple, what percentage were kept as employees?
Yeah, it was a high percentage. I can't remember the exact number, but it was over a third that actually got full-time employment. So that's a really exciting.
I spoke with Pam about this. She's super excited if you ever get to meet her, and she was saying that one of the comments she got from some of the supply chain operators, private sector, was that the staff that she brought in as interns, no skilled, and skilled up, were more skillful than some of the staff they already had. I mean, that's a statement to the program. Thank you so much. Now, ASEM has undergone a bit of a transformation in the last few years. Douglas, you've led that up. So talk to us about some of the exciting things that both public sector and private sector can benefit from ASEM.
Well, I think a couple things specifically, but I think partnering together in private and public partnerships, I think, are super important to influence what we do in the future. And we were all discussing that very early this morning in any case. But I think more specifically, I think two things. One is going back to my discussion point on career pathways. So yes, we have the challenge that we all have spoken about, which is attracting people into the profession, getting foundational knowledge. So we've done a lot of product development to assist with that. But at the other end of that career pathway is equally as important, because it's great to have the workers to do that, but I also need transformational leaders. So next month we're announcing our first certification in transformational leadership. It's our certification to transform supply chains. It's the first certification of its kind. And I'm super excited about that because I think that's a very underserved area. The second is last month we just launched our first workshop around building a sustainable supply chain. It's still very unfortunate that we have supply chains which are not operating to the ethical and ecological standards that is necessary for our planet to survive, and for companies to also reinforce the ethical nature of what they do in supply chain procurement and other aspects. We're strong advocates for sustainability. I need the organization and all of you to amplify that voice, or we won't be having a conference in 10 years. So please, take advantage of either of those opportunities. We worked very hard on both of those programs. And again, the sustainability workshop was launched last month, and our new certification for transformation will be launched in July.
Great. No, thanks. So lots of things to be looking out for and engaging with. So Zuka, with ARC, you've alluded to some directions that you're taking in Nigeria. What are some of the exciting things that you'd like to share with us that you're focusing on in this workforce space?
So last month, Nigerian government endorsed the PTD Health Supply Chain Professionalization Framework as the standard framework for professionalizing supply chain people. So, woohoo. Fantastic progress as a country that is the standard we will be adopting. And then what that means, and if you could just imagine the scale of that, is that, like Rebecca said, everything is beginning to add up, because when we started working, there was no singular university delivering master's degrees or even PhDs in supply chain management. But we were one of those that started advocating for that, together with Pamela Steele, and now we have universities that deliver master's degrees. And what that means, we have the education sector ready for defining some of those standards to deliver those master's or whatever degrees, even bachelor's degrees. So that's there now in Nigeria. We have the government adopting this framework. We have the states that have the supply chain teams, but they didn't know how to define their job descriptions or what standard, what title. You know, you come to Nigeria, you have, I'm a supply chain specialist, I'm an associate, I'm a director. It's all over the place. You can just pick a title, and that works for you. But now we have this framework that gives clarity, and the government have said these are the standard titles we're going to put into place. And states are ready to start adopting that. So you can imagine what this will mean in the next 2 to 3 years, that we have, you come to Nigeria, you can say, if you want to be this is my pathway, go to this university, you go to these certifying bodies. We have ISC with us, we have ASCM that have brought in like Scorpi. It's all adding up, and it's very exciting to see, so it's great.
And what's particularly exciting for me to hear is that you've mentioned both supply features and demand features.
Yes.
It's no point just focusing on the supply side. The government side, particularly in the public health, has to really define their job roles, define their career pathways in order to match those together.
Exactly.
I'm getting shivers. So, Dominique, again, this sort of global perspective, we've started off this presentation with the professionalisation framework, but what is it that you're helping the global community to focus on?
I mean, the Nigeria example, of course, is probably one of the most exciting pieces for me. And of course, the work that we just did in Rwanda last week, also working with the EAC community to do a very similar roadmap. But I sort of just wanted to talk about building on what Doug just said around transforming leaders. And so when we think about professionalization, some of the goals that were in that first slide is that it is all about giving recognition to the profession, thinking about career pathways. I think especially in the global health scene, it's about also retention and recruitment. But I think the bottom line really is all about we need to build that leadership talent pipeline. Because within the global health space, a lot of supply chain, let's say, leaders have not been supported to develop those skills. And as we know, supply chain is very critical, especially when we're looking at those sustainable development goals that we want to reach, universal health coverage, those specific targets that most countries are working towards. We need to have leaders in place that can achieve those. And so I just wanted to quickly talk about Step 2.0, which is the Strategic Training Executive Program, Generation 2. And so I think PTD is very honored to be able to be the central coordinator for that. It's being offered by 4 donors, USAID, Gavi, Global Fund, and through the IFPW Foundation. And it's really basically, it's looking at traditional learning with on-the-job training and really improving those soft skills in, say, project management, communications, problem solving, all within leadership and change management. And it's very unique. So the one unique point, it is a public and private partnership, whereby there is private sector coaches are working together with the participants on a very specific supply chain transformation challenge, going back to that transformation. And you know, we're now rolling it out in many different countries. I'm very excited to see what's next.
Yeah, great. Thank you for that. I think you'll agree there's lots of excitement in the field, but it's how we take action and move forward. And I think linking up with that idea of that long-term change and sustainability, the realization that it's going to be local leaders with leadership and transformational skills in positions of authority and the ability to engage in that change. And I think those of us who are involved in different organizations that are assisting really feel that we're facilitators trying to create that environment. And it's so exciting to moving along. So let's go to a couple of questions. First one to Izuka. Can you share with us potential solutions you came up with after analysing the training requests by the government? And I think you've sort of answered that question, but I want to change the question a little bit, is how did you effectively change the narrative? So you've got the governments asking you, I want training, want training, want training. You mentioned part of that was, I want training because you go to a nice hotel and that looks pretty good. But help us understand how you took that narrative to then a systematic approach.
Thank you very much. I mean, the greatest mistake you make is not listening to people. When someone tells you that this is the issue, and the whole idea, they actually thought that the partners were being selfish about this. They said, if I do this training and I do the work, you will get promoted. You come back next time with an SUV, that was the exact word, as a director, and you tell me to do the work. So it's a bit of a complex situation. So what we did was, okay, to say, we will provide the training, but we were going to go back to the government to say, now, give us the people you want us to train, but tell us what they are going to solve. What is what kind of, give us a project approach. And we will start with a 3-month project, not train me, a project. Let the government tell us what the people will do so that the training will be part of the project. So that was how we started. At that point, there was no national health supply chain strategy. It was states trying to navigate their way through program support. So really, it was to projectize it. That kept them, actually gave them more a kind of reward because they saw that I'm going to address inventory management across 20 health facilities. This is the project need, so they had to come up with concept notes, how they would do this over time, and the training now had to fit into that whole process. So they were not focusing on the training, they were focusing on the project. And at the end of the project, we will give them a kind of like a ceremony to celebrate their progress in the project. With that kept them engaged, and they saw beyond the training, but we did give them the training.
Great. And I would encourage your project to not just write up the results when you get to the end of that project, but I think this methodology of engagement and moving from a discussion around training to a more systems-based approach, we can learn from your experience, and I'd encourage you to write that bit up for us to share. So the next question, Douglas, you're going to smile on the inside, and you're going to
probably on the outside too.
And on the outside, here it comes. Is there a toolkit for universities and training providers to develop supply chain content or deliver supply chain content?
So great question and a huge challenge. So our academic strategy is exactly that, is to, from an academic standpoint, you really have two choices, create or curate. And so this always becomes the challenge. So we've actually had more success in two areas with academic alliances. First is in like 2-year institutions versus 4-year institutions. Dare I say, sometimes where the ego is just a little bit lower. So the desire or the willingness to curate content to supplement curriculum has been higher. Our biggest success in combination with academic institutions, however, has been around workforce development, where the academic institution is the recipient of funding, and then some of our foundational learning gets adopted for workforce development, and we assist in the train the trainer and building an instructor base that allows that to be more easily replicated. But we still have a lot more to do, I think, around trying to understand ways in which curriculum can more easily be adopted. But our successes in the past have been built around those two things. But as we go more global, I think to the points that our colleagues have been making, I think the opportunity, where there's a less established presence, perhaps where the ego is lower, where the need is higher, I think we have more opportunity to have what we call content for credit, so that they can actually use certificates or certification programs that not only give you at the end of that a bachelor's degree or whatever that might mean, but you get a bachelor's degree and you get a certification and you get a certificate product, etc. What we do know from our career and salary surveys that when you couple those together, a bachelor's degree, for example, with an ASCM certification, this dramatically increases your salary and career progression. And we have factual evidence of that now over a number of years. And I'm talking about double-digit increases with that combination. So we also have the proof point that that return on education number to an individual means a lot to their career and to their wallet.
And I think one of the links back, again, to the development space is the need to often have professional credentials recognized as much as academic credentials. One of the questions here is pointing to, like most people in the room, sort of fell into supply chain over time, developing skills and competencies and so on. And how do I now get recognized for that? And I think different tracks from ASCM and so on, where you can get those credentials, is one side of it. But on the demand side is also how are those recognised both in private sector workplaces but by the government. And at this point I want to come to Rebecca. I mean, Village Reach did a great project a few years ago in Malawi. Again, a needs-based project. We're looking at supply and demand. In a couple of minutes, you want to just talk about that with your technicians?
Sure. So in Malawi, we worked with a university, the Malawi Center for Health Science, I believe, to create something called the Pharmacy Assistant Program, which is essentially created a different cadre of workers to support those workforce gaps that we saw on the ground. And it was hugely successful. I think we did an impact evaluation and showed that rates of stockouts went down once that support was embedded into the service delivery. Reporting rates went up. And it was a very successful project, and we're hoping to reignite it with some additional funding in Malawi now. But I also think it's a model that can be replicable in other places. It's a HRH intervention essentially that adds another cadre into a country that doesn't have listed out cadres, like we were saying, listed out junior logisticians, senior logisticians. And we all know that from the work that we do that pharmacists are overwhelmed. They're doing too many things at once. And so that pharmacy assistant was there to provide that additional support.
Yeah, I mean, I've watched that project from the beginning to the end, as you know, and what particularly strikes me as exciting is the supply and the demand-based approach. It wasn't a drop-in curriculum, it was a needs-based look at both what staff are needed, what competencies are needed, what's the education, who's the local education partner to work with, how can that be developed, how can that be handed over. There's always questions of ongoing funding and sustainability, which you're working on, and then the impact statement, all of which is published. And a great case study. Next question coming to you, Dominique.
Yeah.
Some in the room are looking for opportunities for specialised training in supply chain management, particularly for underdeveloped markets, those with low infrastructure and so on. So particularly, let's talk about public health. The ASCM products cater across a whole range of environments. But what experiences have you had in other sort of public health education opportunities that people can get access to?
Well, and so I've spoken about this already, where I was in Rwanda last week and working with the Regional Center of Excellence. They have a very long name, very long acronym, but they were set up. What was it, like 10 years ago now? To basically be a center of excellence, a hub for innovation, research, and training. They started off by doing a lot of training. Now they're actually really are becoming that hub for innovation. But they are rolling out many cohorts of master's degrees in health supply chain management. I'm very excited to see where they're going. And I heard last week as well, and I mentioned that early this morning, that they had 400 applicants last year for 40 positions, but it just shows there's a high demand for that kind of degree. And of course, in the West African region, we have Logivac at the National Public Health Institute in Benin that is also doing both technical training courses as well as a bachelor's and a master's degree course in health supply chain management. But we need to see a lot more of this. You know, those are just two examples that have existed for many years now, but there's a lot more need for that.
Great. Thank you so much for all your questions. We got to most of those. We're coming to the last few minutes, so we're going to the quick fire finish. There's opportunity for each of you, one clear take-home message. People leaving here, what one message do you want them to take home? 30 seconds each, go.
Workforce development initiatives, such as the ones we're talking about, benefit both the public and the private sector. It's not about public or private. We can work together on this and mutually benefit from it.
Thank you.
Our mission is to make the world better through supply chain, and we can't do that alone. So tell us what we can do to help you.
What an offer. Where will you be for coffee?
Right out there.
Out the door. All right, excellent. Zuka.
The training must make sense. Government must define the standards and the pathways to how the trainings would really impact the employee career pathway, or else it will be wasted, lots of waste in the system. We must avoid the waste. Thank you.
Maybe you can go to the next slide.
There's one. We'll go here.
Oh, it's not there. Okay. Attend the PTD Global Indaba in March of 2024. We can keep these conversations going on professionalization.
Great, yeah. For those of you who don't know, there is an Indaba, which is a global meeting focusing on workforce issues. It's born out of the health sector, but will be relevant to the private sector as well. It's going to be held in Thailand. So, Jonathan, are you in the room? Wave, stand up. He's got the pamphlets. So just as we head to close, I just wanted to back up a bit. So this next slide shows some of the resources we spoke about. So in today's panel, we've tried to take you on a bit of a journey. We've got you in here under the pretext of trying to unpack aspects of professionalisation. One key message I want you to take away is that capacity strengthening of our workers in public or private sector is not just training. If you're just focused on training, you will not succeed. You need to have a more systems-based approach. I need to think about what that is. One of the systems-based approach that we've been brought to our attention from a global perspective is the professionalisation framework that People That Deliver offers. And this is a country-wide framework that wants you to understand both supply and demand. Who are the actors? How can we change the environment? This takes time, and we use a competency-based approach. Village Reach's model helps us to understand that it's not just about the workplace, it's about understanding what's required, even as we noted from the initiative for girls early in their careers, is from early on, from high school, from early education in university. Where is it that these pipelines coming from? But not only that, understanding roles. We heard about the importance in Nigeria of understanding roles, getting those structures right, putting that in place to get that career happening. We also, with ARC, there is a range of resources on the Africa Resource Centre site. And then, of course, Douglas, in his role, has made available many different resources for our whole supply chain community to use. I think the challenge for workforce development, particularly around professionalisation, is it takes time. And if you are in the public health space and you're asking who would like to invest over 10 years in workforce development projects in a country, no one will put their hand up. It's an ongoing struggle to get investments in order to get them to systematically build. So we have a challenge as a community where we work to work together to create competence. Certainly, training is needed, but to think beyond that, to challenge ourselves for systems-based approaches that not only improve the competence of workforce, challenge organisations to ask the question, who are the right people for the services that we offer? And then in a country context, what are the structures from public service, particularly from a public health perspective, from education that are meeting the supply and the demand? With that, hopefully you've got something from today that you can take in action. And I would like you to join with me to thank our panelists for their interaction with us.